Hello, this is going to be a little video that Miss Clemmy and myself, Mr. Reuter, are going to do to kind of help all those interested in learning the bones and all the bone parts for the anatomy test. So we'll start out first. You see the whole skeleton over here. We're going to go through some of the easier bones that you guys probably were first acquainted with back in grade school. We had you learn in biology class. We're going to review them again now in anatomy. So again, we'll go to the skull a little bit closer a little bit later on, but on the axial skeleton here, I'm going to start in the rib cage area. And as far as the breastbone area, there's kind of three key bones here to remember. On the very top is a little we call anchor bone up here. You kind of anchor some ribs. You got the clavicle and the breastbone there. That's called the manubrium at the top. Then in the middle, the bulk of the breastbone will be the sternum. And at the bottom of the breastbone will be a little triangular piece down here, which is called the xiphoid or xiphoid process. So you got the manubrium, the sternum, and the xiphoid that will make up the breastbone area. You've got a lot of ribs in the rib cage protecting some vital organs there. At the top of the rib cage we have a couple of, you guys call them the collarbones, but their name is the clavicle. And they say it's one of the bones that's broken probably the most in the body is the clavicle. So it's going to be at the top. Going to the appendicular skeleton for a little bit here. We're going to have the arms. As far as the arms, we have the upper arm bone here, which is referred to as the funny bone or the humerus. And again, you get that hit on the outside at the bottom down there. You feel a little tingle sometimes, so that's where that little funny feeling is going to come from. In the forearm bone, a couple of bones down here. They look very similar, easy to mix up. They're going to be pretty much the same size, but the way to kind of help you know which is one is bigger by the wrist area down here. The other one will be bigger by the elbow. The one that's bigger by the wrist is going to be known as the radius. And to help remember, a little alliteration there, I always say R for wrist, R for radius, to kind of help you out a little bit, even though I know the W in wrist. We got the other one over here then will be the ulna, bigger by the elbow. In the wrist, there's about 8 different bones in there. They all have individual names, the pisiform, the hamate, and so forth. We're going to just learn the group name at this level. You guys move on to the next level, you'll be getting a little bit more detail. But the group name for these 8 wrist bones are called carpals. You've heard of carpal tunnel syndrome and so forth, where the carpal's going to have a problem there. Then we have 5 hand bones that are all attached to those wrist carpal bones there. These 5 hand bones right here are called metacarpals. And then you have a lot of finger bones. Matter of fact, if I use my hands, you can see you got 3 bones in each of your 4 fingers, only 2 in the thumb. So you got 14 hand bones that are all called phalanges. And you got 2 hands, so you got 28 phalanges, and also your toes. So 56 of your 206 named bones are called phalanges. So now you're down to 150. All right, moving down then, we'll have a little bit closer view later on of the pelvic area. But as far as the lower appendage, the leg, we have the longest bone in the body, which will be the femur, the big thigh bone there. The knee has a very, a lot of stuff in the knee joint there, so you have a little bone to protect that knee joint. That bone's the kneecap called the patella. Then in the lower leg, we do have a couple of bones. One is bigger, one is thinner, so it's kind of easy to tell. The bigger one will be the tibia. The one on the outside, littler one, will be called the fibula. Then moving down to the ankle. And again, in the ankle, we have a whole group of bones similar to the wrist. In the wrist, we call them carpals. In the ankle, now we're going to call them tarsals. In the foot, there are 5 main bones, again, attached to those tarsals. So they're called the metatarsals. You've all heard of stress fractures. Well, if you pound the foot a lot, these are the 5 bones that usually get little hairline cracks that they refer to as the stress fractures. And then again, we got 14 little toe bones there called phalanges. All right, now we're going to start getting a little bit more detail. And before I go into the detail, there's probably 6 words that you guys, little terms you guys should know that will help you now with some of these tougher bone parts. All right. Whenever you see any kind of a piece in a bone that's going to stick out like we see right here, that's known as a process. We'll be using that term probably about a half a dozen times now as we're going through these individual bone parts. All right. Whenever you see a large hole that goes through a bone, that's known as a foramen. So we'll have a few of those as we're moving along. We're going to have a time where we're going to have like a bump on a bone. Whenever we're going to get a bump on a bone, we're going to have a tuberosity. It's going to be. So you'll get a bump on the radius right in this area right there, which will be a, well, here it is up here, will be a tuberosity. So we'll have some of those coming up. We also have, sometimes you have rounded bumps in pairs. If you have rounded bumps in pairs, they're called condyles. And a biggie will be, we're going to have some pits in bones. Little like grooved out areas where bones can slide together, like a big pit right there. Any kind of pit is called a fossa. And then we'll have a couple of places where we're going to have like a ridge on a bone here on the pelvis, and a ridge will be a crest. So those 6 are pretty important to know if you want to help yourself with learning the bone process. Tuberosity, condyle, crest, fossa, and foramen are key words to know. Okay, so we'll go to the skull. As far as the skull, remember now when you guys came into the world, you guys had to fit that skull through this little opening in the pelvis right here, and if you look, it's not going to fit, so you couldn't come into the world with one big skull cap. Plus you want a little room for the brain to enlarge, so lucky for us, our skull had little pieces and a lot of soft spots when we first came into the world, so we're going to have some different skull bones to learn. Also, when these skulls did grow together, they formed little seam-like pieces. They're called sutures. And again, you move on to college, they have names for the lambdoidal, coronal, frontal, sutures, and so forth, as you'll learn those, but we aren't going to worry about those at this time. But as far as the skull cap, some of the key bones you want to know. The forehead right in the front, nicely named the frontal bone. In the back upper part of the skull, we have 2 bones there. Those are called the parietal. Moving to the posterior or the back of the skull, we have a thick bone back there called the occipital bone. On the side, we have, you guys call it your temple, but the bone is called the temporal bone. The temporal bone is one of the thinnest of your skull bones. Any kind of a severe blow to that area will cause a lot of damage to the brain, concussions, things like that, whereas the occipital and the frontal have a lot more protection. So those are your key bones to know as far as the skull cap. In the face, we have 3 bones that are going to help protect your eyes, which are very important. The bones on the outside of the eye, you got one on each side over here, is called the sphenoid bone. So the one on the outside is the sphenoid. On the inside, you need to get a little closer to see that, but there are 2 bones on the inside. One's a little bit further back. The one further back is called the ethmoid. The one closer to the nose is called the lacrimal. So your 3 eye bones are the lacrimal by the nose, ethmoid further back on the inside, and the sphenoid on the outside. Going back to the nose, you have a little piece that juts out here. Your nose is mostly cartilage with a little piece to attach to. That's called the nasal bone. At the floor of the nose, there's a bone there called the vomer. It's kind of horizontal at the floor. To protect the side of the face, you got your cheekbones that are kind of arched out. Arches in bones make them a lot more supportive. These are called your zygomatic bones, the arches for your cheek. Then in the mouth area, your upper lip or the mustache bone is called the maxilla. And then a very strong bone that's going to be larger than you think it is, that's going to attach and be a little hinge-shaped joint there, will be your jawbone or the mandible. A couple other parts to know with the skull. You guys got to be able to hear, so you have a little kind of a tube-like passageway that goes in the skull there. That tube-like passageway is called the auditory meatus. And also, here we got a piece that sticks out. We said if it sticks out, it's called a process. Here's where your neck muscle is going to attach. That's called the mastoid process. And then one last thing, you need to have an area where the brain is going to attach to the spinal cord. So at the base of the skull, where your spinal cord comes out, will be called the foramen magnum. It's a large hole there, so foramen magnum is what those two words mean. And that takes care of the skull. All right, so we're going to go to our spinal column next, along with the pelvis. And as far as the spinal column, we are primates. One of the key criteria for being a primate, we can walk erect on two legs. So in order to walk erect, we're going to have some curves in our spinal column. So you have kind of an inward curve, you got an outward curve, inward curve, and a little protection back by the pelvis down there. We got 31 vertebrae. There are going to be group names for these vertebrae. So the top 7 vertebrae in our neck area right here between my fingers are known as the cervical vertebra. Then we're going to have 12 vertebrae in the outward curve that are all attached to ribs. And those are called the thoracic vertebra. Then our largest vertebra are going to be down in the lower part of the back, where most back injuries occur because of that inward curve right there. And these 5 large vertebrae at the very bottom are called the lumbar vertebra. Then, to kind of help protect a little bit, if I get my piece off here, there's a piece where you got 4 to 5 vertebrae that are all fused together. And that piece is called the sacrum. And at the very tail end, we have our little tailbone at the end down there, the very last vertebra, and that's called the coccyx. So, quick review. We got the cervical in the neck. We got 12 thoracic. We got 5 lumbar. We have the sacrum. And we're going to have the coccyx at the very bottom. Also, every vertebra will have a hole that goes through there, and right now you can see we got some yellow representing the spinal cord, but that hole lines up, and that hole is called the spinal foramen that runs through every vertebra. Also, every vertebra is going to have a little piece that kind of juts out to protect that spinal cord, and this piece that sticks out will be called the spinous process that every vertebra is going to have. So there's a couple of key points there with the vertebra. Moving down to the pelvic bone. In your pelvis, there are 6 bones. We have 3 pairs. So as far as the easy parts here, we have a pair of big flat bones you see right here on each side. These are called the ilium. In the front lower, we have a couple of bones that are called the pubis bones, or the pubic bone. And again, for childbirth, you get a little vertebra in between there, so the females, you can have a little bit of flexibility to make the opening a little bit larger. And then in the back here, our third piece of our pelvis will be the loops in the back, and these loops are referred to as the ischium. We got 2 ischium, we have 2 ilium, and we're going to have 2 pubic bones. But we have quite a few other parts now in the pelvis that you should know. First off, the place where the femur is going to fit into our pelvis right here. There's a big cutout area there, and this kind of grooved out area is called the acetabulum. Then we're going to have also a hole by the ischium right here where major blood vessels run through. This hole, again as a foramen, is called the obturator foramen. Then we're going to have a little notched out area where a major nerve will come out from our spinal cord down to the legs. The major nerve is the sciatic nerve, so this notch is called the sciatic notch. So again, 3 key things: the sciatic notch for the major nerve, the acetabulum for the femur, and the obturator foramen for the major femoral blood vessel to come through. Then on the ilium, we're going to have a little bit of a ridge right here to help protect again from a lot of blows on the side. A ridge is a crest. This is called the iliac crest. All right, moving on to the arm. We have a lot of the bone parts. Again, they're there for a purpose to help with articulating the elbow or muscles to attach. If you look closely on the humerus bone here, there's kind of a rounded bump about halfway down the humerus bone, and that rounded bump is going to be where your deltoid muscle attaches. That's called the deltoid tuberosity. In the front of the humerus, there's kind of a cutout area at the top up here, a little groove, all right? And this groove is where you're going to have your biceps muscle attached, so it's called the bicipital groove. So for the muscles, deltoid tuberosity and bicipital groove we're going to have. Moving down to the bottom of the humerus, we have a couple of pits. A pit's going to be a fossa. In the front of the humerus, kind of a smaller pit there, that's called the coronoid fossa. In the back of the humerus, a larger pit in the back there, that's called the olecranon fossa. Then, at the very bottom of the humerus bone is a spool-shaped structure that allows these bones to articulate and move over, and that little spool is known as the capitulum. So, at the bottom, coronoid fossa in the front, olecranon fossa in the back, and we have our capitulum. Moving then down to the forearm bones. Again, we got the radius and the ulna. The radius is going to have a couple of parts to it. There's a rounded bump at the top of the radius because when you pronate your arm, that will kind of glide back and forth over the ulna. This rounded bump is a tuberosity. It's on the radius. It's called the radial tuberosity. At the very bottom of the radius, always pointing toward the thumb, is kind of a sharp point right there. It's going to be sticking out. It's a process. It's called the styloid process. Then moving to the ulna bone that's bigger by the elbow. Recall the two pits we had in the humerus. Well, we're going to have pieces in the ulna now. You can see in the front that's project out and a big projection in the back. Those will be processes. The one in the front that's going to slide nicely into the coronoid fossa is going to be called the coronoid process in the front. The one in the back, the big bump that you can feel at your elbow there, that's going to slide into the olecranon fossa is the olecranon process. And then on the side of the ulna, you can see with that capitulum right there, a little notched out area that's referred to as the semilunar notch. Because semi means half, lunar means moon, so a little half moon structure there that helps to articulate and glide. So, lots of parts there on the ulna. Olecranon process in the back, semilunar notch on the side, and coronoid process in the front. Okay, moving on to the femur, our longest bone in the body. We have 5 key parts to know there. Again, you have a whole bunch of muscles in the leg, the hamstrings and the quads to attach. So in the back of the femur, as I turn it around, so the left femur I have right here, as I turn it around there, you see some big pieces that stick out. They're bigger than a process. They got their own special name. So at the very top up here, the large piece that juts out for muscles to attach to is called the greater trochanter. Then, a little bit lower on the inside is called the lesser trochanter. So you got the greater trochanter, the bigger one at the top, lesser trochanter, a little bit smaller one, a little bit more to the inside. Then as I turn the bone around here, you can see that there's a ridge that goes between those two trochanters, and that's called the intertrochanteric crest. Again, a crest is going to be a ridge. Inter means in between those two trochanters. So a big word, but it makes sense. Intertrochanteric crest. At the bottom of the femur, we have a couple of rounded bumps in pairs. If they're going to be rounded bumps in pairs, they're called condyles. All right. Again, this is the left femur. This is going to be the outside of that left femur. The bone, the condyle on the outside is going to be called the lateral condyle. The rounded bump on the inside is referred to as the medial condyle because it's more toward the middle. So lateral on the outside, medial on the inside, and those are the condyles. In the lower extremity there we have our tibia, the big shin bone, and the fibula. Some of the parts to know on the tibia. Again, you're going to have a muscle that's going to attach on this rounded bump right here, go down to the foot to help pull the foot up. And this rounded bump right here then on the tibia is called the tibial tuberosity. Then, moving down by the ankle, you guys can all feel on the outside of your ankle you have a rounded bump. On the inside of your ankle you have kind of a rounded bump down there. And we'll stay in the tibia, which is on the inside right here, that kind of rounded area at the bottom of the tibia that you can feel that sticks out there. It's on the inside, it's called the medial malleolus. So medial malleolus at the bottom, inside of your ankle. On the fibula bone, on the outside of the ankle, again, is a kind of a large round bump there. It's going to be on the outside, so it's called the lateral malleolus. Then, we mentioned before, we had a whole group of tarsal bones. There's a couple of bones I want to stress here that we want you to know. First off, we're going to have the big tarsal, which you can see right here, where the tibia is going to rest on top of that big tarsal. The name for the big tarsal is the talus bone. In the back, we're going to have our heel bone, which is a pretty good sized bone, and the name for the heel bone will be the calcaneus. Okay, moving on to our last bone here will be our shoulder blade bone, which is called the scapula. On the scapula, we're going to have, again, a joint that's going to have a lot of articulation, a lot of free movement. That arm can move all the way around if you want it to. So you're going to have a lot of ligaments and cuff-type muscles to hold that shoulder in place. So we have some pieces to help out with that. First off, the little pit where we're going to have this humerus bone fit into right here, this little kind of grooved out pit, is called the glenoid fossa, where the humerus will fit in there as far as the shoulder joint. Then there are two pieces that stick out quite a bit. We have a large piece, a little bit more toward the back here, and a little bit smaller piece in the front. But again, that's for many cuff muscles to attach to that. First off, the large piece, which is going to be a little bit further in the back here, is going to also attach to your clavicle. This is called the AC joint. The reason why is this large piece that sticks out right here is called the acromion process. So A for acromion, and then the C for clavicle. That's your AC joint. So acromion process is the large one that attaches to the clavicle. In the front, we have a little smaller piece that juts out, and that's going to be called the coracoid process. People get confused. We had the coronoid process on the ulna in front of the elbow there. This is the coracoid with a C that's going to be up in the shoulder area on the scapula. And one last little bone that you can't really see here, but underneath the skull is a little horseshoe-shaped bone. This bone is very unique. It has no joint to it. It's called the hyoid bone. If you guys watch all your CSI shows, whenever the hyoid bone is broken, that usually is a sign of strangulation. And that should take care of not just our 206 bones, but many bone parts that are going to be important because we have muscles attaching to them, ligaments running through, blood vessels going through. And again, if you guys know all these, you should be sitting real well for that next level.